undiagnosed ADHD because I love to move. I love to move and I love to meet people and I love to be here. Landon, when you invited me, I didn't know you will connect me to Steve. I had a great meeting with Steve, with Dr. Stefania, and you are a graduate of the same program, Graduate Health Education at UNCG. I know you very well. You are putting me with great people, and I talked with Liz. What are you doing to an Egyptian extrovert? You are giving the pleasure of my day. Before talking about my story, I want to give you and tell you that you are the best caring people in this society. You know why? Attending a meeting from 7 to 9 to talk about health and community engagement is a lot. I am here because I have 3 kids. It's a pleasure to escape from them. So I am justified being here. But you guys, being during this time, it means you care. It means you are here for something so important. It means, Steve, that you are always in the very important spot in this society to make a change. Yes, yes, I feel it, and I'm so grateful with seeing you today and talking to all of you. I'm happy. This is a happy day for me. So who I am and how did I get here today? You won't imagine the story. I want to share, Catherine, who I was. Because in Egypt, I grew up very poor. My parents are illiterate. And we really struggled with all the social determinants of health. I was pushing that huge stone. This baby was about me in Egypt. But despite the environment, my genetics was into curiosity. I loved education. I loved to be a strong woman. A very powerful, an agent of a change. But you can't say this in Egypt. Why? Because it's a culture very conservative. I have to follow the herd. What does it mean, follow the herd? Graduate, marry, and have kids. This is your life story, Naglaa. But I didn't want this story. I always told my parents, I want to touch the stars. They said, no. We are born in a slum area. You die in this area. In my mind, my mom always told me, you are my kid who is crazy. Why do you want to touch the stars? I said, I will, but in my mind, I kept my dreams very secret. And what is interesting about today, I was trained in Egypt as a medical doctor. And Catherine, I love counseling, but I was a psychiatrist. I loved working with my patients. I love them so much. I'm very passionate about mental health, psychosocial support. I loved it. But also I loved working with the community. I love diversity, Stefania, so much. We had international students coming to the medical school, and I started talking with them and practicing my English. I never had a class in English, and I know I have an accent. My 3 kids are sometimes mean to me and say, Mama, how did you say that? You have an accent. I said, what should I do? I will have this accent forever. Maybe it's my uniqueness. Maybe. So, I had a passion of working with the community, Liz, like your love for the community. I loved psychosocial support more than mental disorders. You know why? Because I learned from the clients, I learned from the community, I grew with the community. They taught me a lot. I am not the expert. The community is the expert, and I love that. I volunteered with the Red Cross for years and years, and I was the lucky volunteer who was offered a job with the International Federation of the Red Cross. So I worked 2 years in the Middle East as a regional advisor for psychosocial support programs. I trained volunteers on how to be empathetic, passionate, how to help their communities. I loved that so much, till my Egyptian-American husband said, Naglaa, move to the US, immigrate to the US. I said, yes, this is the huge escape. I'm escaping from Egypt to the US. Hey. But it was not hey. Because it was not easy. I don't have a family until this moment here as an immigrant. And when I moved here, I was hooked into maternity and being a mom, 3 kids, 11, 8, and 5, very bossy. Very smart, very beautiful. They have green eyes like Catherine. And Dr. Milberry, very beautiful. When I was holding Aliyah, my oldest one, she has green eyes. People used to tell me, "Where is her mama?" I said, "I am the mama." Really? And I didn't know that this is not okay. To be, denied being a mom because my kid has green eyes, this is my progression. But I learned this in public health education. Oh, howlala. So I stayed home 7 years with my 3 kids because I was on my own as a mom. And Stefania, tell them how difficult it is. It is very difficult. But my passion was still in my mind. I wanted to touch the stars through education. I came to public health education. I got my master's. And the same month I got my master's, I was hired at the Center for New North Carolinians to be the senior coordinator for the immigrant health access. I love that. You know why? Because every day I serve people who look like me. Catherine and Dr. Milberry talked about trust. Bring me, I can bring trust. Because I can serve Egyptians, Sudanese. Je parle français. I can speak French and talk to the French people. Me gusta mucho hablar español con ustedes. Yes. So, the best job ever is to be an immigrant working with your fellow immigrants. This is a trust, but enjoyable. Diversity, beautiful. Diverse people are amazing. Without the diverse people who came to Egypt, if I was phobic and I didn't connect with them, they were the power that took Naglaa from a slum area in Egypt to be here and seeing you and talking to you. Diversity brought me here. Differences brought me here. I love differences. You know why? Because it is delicious. I love food. Anybody else in the room who love food? We love food. Enchiladas, pupusas, falafel. Please give me the pleasure of my life, food. Yes. I love my job at the CNNC because I do what Dr. Milberry is doing. I am the community health worker, and I supervise community health workers. So you make my presentation easy. Yes. To help my clients, I have to connect and visit Dr. Milberry. I have to visit Catherine. 1 minute left, Lyndon. Why? I want to stay here forever. So, I totally agree with Dr. Milberry that we have to connect. We have to work together. I have to visit Catherine. I have to invite her to come for coffee or falafel some days. We can do that. Because yes, the real connections is the real change in life. Change will happen when we connect. I think COVID, and my takeaway, because Lyndon said, Naglaa, we know that we need a call for action. Do you know, Lyndon, what is my call for action? Do you know who or how I was brought to the US? Kindness. Without kind people who were willing to support me in my lonely fight against oppression and literacy and everything else, I wouldn't have been here. Without kindness, I wouldn't have been at the CNNC. I got my master's, I'm doing my PhD, Lucine in the same department. My PhD is on culturally responsive and equitable evaluation. I will be chasing him, working with him. So I am the luckiest. I am really the luckiest, but what kept me going and what keep you guys seeing faces like myself is the kindness. Show it, say it. To strangers, to friends, to neighbors, we are kind. COVID showed us that to build connections, say it, show your kindness. Say hi, say how are you. Talk to Liz came and talked to me, she never knew me. But I felt connected just for her talking to me. My action and call of action, show your kindness. Don't be shy. Yes, we are shy. Not everybody's extrovert. Yes. But really, you will make my day and make the day for everybody else in your neighborhood, in your connections, in your network, by showing your kindness, by showing how amazing you are, and tell people how amazing you are. Tell Catherine and Milberry how beautiful they are. Tell Lyndon that you are the soul catalyst. You are phenomenal. Tell Lucine you are the best evaluator ever I have ever seen. I am sincere, but I need to say, I need to express it to them. It's a pleasure being invited to this space. Thank you so much.